And to shed light about the vaccination campaign, which did start in Egypt yesterday, we are very much delighted to be joined over the phone by Dr. Magdy Adli, Senior Inspector in the Health Insurance Authority. Good morning, Doctor.
Good morning, having a good day.
You too, sir. Sir, first of all, which vaccine now is offered in Egypt? And can you tell us more about the Chinese vaccine, Sinopharm, which is started to be available for vaccinating the first-line doctors and medical staff in quarantine hospitals starting yesterday, Doctor?
All of us watched yesterday before 24th of January 2021,
Yes.
the great medical event. As the Minister of Health, Dr. Hala Zaid, gave a green light for starting the process of vaccination in a quarantine hospital
Yes.
in Abu Khalifa and Ismailia, and other two quarantine hospitals with a Sinopharm vaccine.
Yeah.
And we supposed to shed more light about Sinopharm vaccine. That vaccine has been tried on clinical trials in Egypt on 3,000 volunteers here in Egypt. And the process of vaccination didn't start before taking the EUA from Supreme Drug Authority. EUA is Emergency Using Authority. And many analytical processes have been done before vaccination. And that vaccine of Sinopharm, they find that it gives like 86% efficiency and like 99% creation of antibodies once it's introduced into the body.
Yeah.
And 100% preventing the progress of symptoms, which sometimes is the main factor for this for many cases.
Yeah.
And Ministry of Health said that they covered or providing like 50,000 batches last December 2020, and having another quantity of this vaccine with the help of Emirates State and company of G42.
Yes.
And they make a priorities for vaccination and classifying that priorities for 5 groups.
Yes.
One is the medical team in quarantine hospital. Second is the medical team in triage hospital. Then the elderly people over 65 years old.
Yes.
Then the people having a chronic disease and like diabetic or having a problem in cardiac disease.
Yes.
Last is the normal people.
Yes.
So the first step is vaccination of medical team, then the elderly people.
Yes. Are there certain segments in the society who are not advised to be given the vaccine? What the age brackets, what diseases could prevent the patient from taking the vaccine or the citizen from taking the vaccine?
Before taking vaccine or receiving vaccine, there is some procedure must be done.
Yeah.
Like registration on website of the ministry, and once the person registered his name, it must be asked some questions about the medical profile of his health care. Like if he having some symptoms like headache or vomiting or nausea, through 10 days within 2 days, 10 days or not, or having even the infection of COVID-19 through 3 months, last 3 months or not,
Yes.
or having a hypersensitivity of some of components of vaccine, so that they be ensured that once he takes the vaccine, after measuring the vital signs for him, it will be in a safe side.
Yes.
He will be in a safe side.
Yes.
So there is no problem of vaccination at all, especially for elderly people who, or people who are having a problem in immune system. And by the way, Ministry of Health create a website for these people. They for elderly people, they can register in that website or can register in the nearest hospital for them.
Yes. Sir, how long does it take for the vaccine to be effective for whoever is taking it?
Sorry.
How long does it take the vaccine to be effective, and would it be effective from the first dose or after the second dose, which would be taken after 21 days?
Look, vaccination is taken as 2 doses, as you know. First dose and the second dose is after 21 days from the first dose. That creation of antibodies is in the 3rd week. So once the people receiving the vaccine, the antibodies is creating from the 3rd week, not from 2nd day or 3rd day. So after 3 weeks, the antibodies is ready for fighting the virus if attacks the body.
Yes. So, Dr. Adli, do you advise here the citizens to take the vaccine, to feel safe about taking the vaccine? What's your point of view here?
Yes, look, there is some people, vaccination is very important for them, especially medical team, especially elderly people who having a problem with immune system.
Yes.
Because, you know, immunity for COVID-19 is through 2 ways. Infection itself with the COVID-19, so that the body creates antibodies against it, or through vaccination.
Indeed, Dr. Yes. Yes.
These are 2 ways. And for these people who are having a problem with immune system and elderly people, they're supposed to take vaccine so that they can protect themselves of infection. And in the same time, as the vaccination process increases, as we can contain the virus to a very little scale.
Indeed, Dr. Magdy Adli, Senior Inspector in the Health Insurance Authority. Many thanks for watching, for being our guest, and for your precious input. Our dear viewers, with that, we come to the end of this edition of The Breakfast Show, brought to you live from our studios here on Nile TV International. You were in the company of my dear colleague Shireen Adil and myself, Maisy Rabia, signing off for now until tomorrow with another crew. It's goodbye.